starting right now.
Mhm.
First, I'd like to welcome all of you to this talk. This is the second episode of our show about international medical licensure exams. It's called Beyond What's Known. Under this episode is under the name of Road to the UK, the first steps, and this talk is given by our dear Dr. Anesa Noor. She's a junior clinical fellow in cardiology at the Royal Free Hospital in London, UK. She's one of our most prominent Mansoura Manchester Medical Program graduates. She graduated top of her class, the class of 2020, and we'd like to welcome her today to this talk. And we're looking forward to many points that she's going to discuss about the PLAB exams and how to get prepared and how to follow up after getting your exams. This is me, Mohammed Nashat, and my colleague Noor Ahmed will be with you and hosting this talk. We'll leave the mic up to Dr. Anisa. How are you doing?
I'm fine. Thank you very much. Thank you, Mohammed and Noor, for organizing this and all your effort behind this. Thank you for introducing me, and I'm glad to have everyone here. I'm honored to be here myself, actually. So let me just start this up with the poll asking what year you're in, just so we know. So if you could just pop in the poll, I hope that works. Launch, yeah. Just so we know what year you're in. Also, if you can write your questions early on in the chat so we can, Noor and Mohammed are going to read them and make sure that I answer them by the end of the talk. And if I see them, I'll try to bring them up in the talk casually. So if you have a question that you really want an answer to, now's the time to put it in the chat. Okay, so I guess most people are in the final year, which is great. And second highest are people that are graduated. Okay, so let me start up this talk with a PowerPoint presentation. I'm gonna share that right now. Hope this works. Let me know if you can see this. Is this visible? Can you see the slides?
Yes, it's showing.
Okay, that's great. Okay, so I'm gonna start up my talk with exactly the first steps that you need to take to start your journey into the UK. Mohammed has quite kindly introduced me. I just started working as a junior clinical fellow in cardiology at the Royal Free. It's just been a month for me, so I'm very, very new to this as well. If you have any questions throughout the talk, let me know. And at the end as well, I'll give you my email address. You can send me any questions through there. So just a disclaimer before I start this talk. The journey the journey to get to working in the UK or in the NHS is they have fixed steps. Like, yes, you do an English proficiency test, and then you do PLAB 1 and then PLAB 2, and then you get a registration, then you start working. But getting from one step to another is very variable. It depends on a lot of things, personal and situational variations. So do not compare yourself to someone else. Do not try to compare yourself to me as well, because my situation is very different compared to other people. I'll tell you exactly what I did and how it all worked out for me. And I'll give you advice on what the ideal thing to do is. So just don't take my words as fact. Also, I tried to research as much as I can before I started this talk to make sure everything is up to date. I'm sorry if I make any mistakes or I don't mention everything. There are clear guidelines and rules as to how to to prepare for every step on the GMC website. It's very thorough. I'd advise everyone to go to the GMC website and read up themselves after this talk so they have a clear image of everything. So yeah, and I'll leave you some resources at the end. I'll send you some links for everything I talked about. So the objectives of this talk is going to be to discuss the English language proficiency test, which are the OET or the IELTS exams. After that, you need to do a GMC online account and how to do that. And then the PLAB 1 exam, the PLAB 2 exam, getting a GMC registration, and then just briefly, I'll talk about some tips before you start applying to jobs. Okay. So the English language proficiency test, the GMC actually has 3 routes where you can prove that you're proficient in English. You can use the OET exam, the IELTS exam, or you can also use your primary medical qualification if you graduated from a country that speaks majority in English. Unfortunately, Egypt is not one of those countries, so that rule does not work for us. I tried to talk to the GMC prior to starting studying for the OET to ask them if maybe they could reconsider, but no, their rules are quite fixed in that sense. So it's either the OET or the IELTS for us. The GMC criteria for an OET or an IELTS exam, as they said in their website, is the OET is only valid for 2 years. So you don't want to take your OET exam too early before you're going to get a PLAB 1 slot. And you want to have enough time to also have the result before you start booking your PLAB 1. I'll tell you exactly how that fits in when I talk about PLAB 1. What the GMC want is for you to do the medicine version of this test because there are different variations of the OET exam to get at least a grade B in all 4 sections. So speaking, listening, reading, and writing. Unfortunately, if you get a C in one of them, you have to retake the whole exam. As it says in the other rule, these grades have to be obtained in the same test and they have to be from your most recent sitting of the test. After you finish your OET and you get your results, the most important information you need from the result certificate is your candidate number. And I'll tell you why in a minute. The IELTS exam, I don't know much information about the IELTS exam because I did not do it myself. But according to the GMC website, it says that it's also valid for 2 years. You need to do the academic version of this test, score at least 7 in each separate section of the test, and an overall 7.5 score. These scores have to be obtained in the same test and your recent sitting of the test, and you have to have the original stamp and test report form. The reason I opted for an OET is because it's quite easy compared to IELTS, or for me, it seemed more attainable. The B seemed easy, so I chose the easy route. But for other people, maybe the IELTS is easier. If you have experience with the IELTS exam, you sat it before, you got almost a 7, I would actually recommend to go for the IELTS because it is relatively cheaper than the OET. But again, everything is subjective. It depends on your level of English and how comfortable you are going for either option. So do your research prior to booking an exam. So I'm going to talk about more details about the OET exam because it's the one that I did. When you book the exam, you book it from the official Occupational English Test website. When you go there, you want to do that prior to your exam by a while because as you can see, the exam that is going to be on the 24th of September, which is quite soon, you cannot book anymore because the booking deadline was on the 31st of August. But for the 8th of October, the deadline is still open till the 14th of September. So you can get that. You want to know when your deadline is so you can book it. And also you want to know when your results will be published. It's usually 3 weeks after your exam. And you also want to make sure that you're booking the medicine exam and not the nursing one, for example. Okay. So how much time is required to prepare? By default, the OET website won't let you book it won't let you book later than a month or more from your exam. And I would recommend that is more than enough time to prepare for the exam. But this also depends on your level of English. So if you think that maybe I don't feel very confident to prepare in a month, and maybe I need more time. What you can do is try the mock exams. So it's going to be in my second point about the resources. One of the most important resources that I use is the free mocks available on the OET website. This is how they look. They have multiple in every category. Uh, the thing is, for listening and reading, these are skills that take time to perfect or to better. You won't see any drastic changes in your reading skills in a week, for example. So if you do the mock and you find out that you're not really making the pass mark, then don't book your exam. Sit on it for a while, try to read medical articles, try to strengthen your reading skill, and then book your exam. So the listening and reading are the most important things that you need to test out before you book your exam. If you feel like, no, my listening and reading skills are amazing, I do read articles all the time and I watch a movie, so I listen to English and I'm fine on that end and you're confident, go ahead and book your exam. So as I was saying, the writing skill is easy to perfect. Actually, my writing was really bad. I prepared for the exam in about a week, which is not advisable at all. But I was writing up to 5 or 6 letters a day just to get my writing up to getting a B grade. So writing is very easy to fix. You know your issues, you fix it. There are various online resources and groups and tutors who will correct your letters for you and tell you your mistakes, and you can work on that. You can find those all over Facebook, or there are also Telegram groups. Uh, so that's one of the most important resource. The other one I want to highlight is the E2 OET YouTube channel. This is one of my main resources for prepping. I watch the videos in here. They're very informative. They give you an introduction to the OET and everything related to it. So I would recommend watching this. You can also go ahead and, if you want a personal tutor or you want to book a course, you can do that as well. There are courses available. Okay. So on exam day, you're going to receive an email detailing if you're going to do all 4 sections of your exam in one day, or if, for example, you're going to do listening, reading, and writing in one day and come back another day for your speaking. So this is important to look at, because if you live in Mansoura like I did, you're going to need to travel to Cairo, Alex, for the exam. You want to make sure you plan your journey ahead and you book a hotel for a day or two, so you can make sure you get to your tests on time. Okay. So what I would recommend doing straight after finishing your OET exam, not even when your result comes out, is a GMC online account. So the GMC online account, I'll tell you why you need to do it before your results, because on the GMC website, you need to submit um, your results. So let's say signing up to this account is going to take some time. So you want to finish all the required information, like your personal details. It asks you your nationality and passport details. It asks you details about your primary medical qualification. This point is important because you cannot uh, put in a date that's in the future. So for example, let's say I'm a final year medical student. I did not sit my final exam yet, and I finished an OET exam and I want to get a GMC online account. You cannot do that, as far as I know. You can correct me if I'm wrong, but you need to have a finish date to get your GMC online account. Your finish date is going to be your final exam date. Um, and then after you get your OET results, you want to go to the OET portal and give the GMC access to your result. The email where you get the results in will prompt you to do this. So this is a very important step that you do not want to miss, because the GMC will go in and look at your certificate through the OET portal. So you have to give them access. It says on the website that the GMC takes 2 days to look up your results and grant you access to applying for PLAB 1. Sometimes it takes longer. So just to be on the safe, to be safe, I'll recommend the day you get your OET results, you give them access and you put the candidate number straight into your GMC account, and then you wait for 2 days. If the GMC has not given you access to PLAB 1 bookings, I would recommend calling them. Calling the GMC always works. So pick up the phone 9 a.m. in the morning, call them, and they will answer and help you as much as you can. Emails, they are very slow to respond to. So calling is better. That is my tip for you. So, to address the elephant in the room, the UKMLA, which everyone is scared about from because we don't know much about it. The information about it is incomplete. It's vague. It won't come into effect until 2024. That's when we will know exactly what it entails. But according to the GMC, this assessment involves two steps, just like the PLAB exam, the Applied Knowledge Test or the AKT, and the Clinical and Professional Skill Assessment, the CPSA. According to the GMC, the AKT is going to be 180 MCQ questions, just like PLAB 1, and the CPSA is going to be just like PLAB 2. But that is yet to be seen. Who needs to take it? According to the GMC, by the year of 2024, if you've passed both PLAB 1 and PLAB 2, you don't need to take the UKMLA as long as your PLAB 2 is valid to apply for a GMC registration. So your validity is lost in 2 years. If you've passed PLAB 1 by 2024, but you have not passed PLAB 2, you're going to have to do the CPSA. If you've passed PLAB 1 and failed PLAB 2, it's the same. You have to do the CPSA. If you only attempted PLAB 1 and failed to pass, you're going to have to do both steps of the UKMLA, which is, it makes sense. It's quite straightforward. So the fees of the UKMLA is still to be determined by the GMC. That is still unknown. And the maximum number of attempts is unknown. So the maximum number of attempts for a PLAB 1 or PLAB 2 exam are known. For the PLAB 2, it's definitely 4 times that I know of. The PLAB 1, I'm not quite sure, but I'm thinking it's also 4 times. You guys should definitely double check that information on the GMC website. Okay, so moving on to PLAB 1. So the PLAB 1, the PLAB 1 exam, when do you book it? There are 4 fixed dates for the PLAB 1 exam. Everyone who's tried to book it knows these dates because they're a nightmare. It's been quite hard to book them recently. The dates are February, May, August, and November. They're always fixed. The GMC releases the seats on a fixed date as well. So it's very important to follow the GMC on social media, on Facebook, and their website to see when they're going to release the seats. So you can prepare your OET in advance. You can prepare your GMC online account in advance, and you're ready for that day to get your seat. So what does this exam cover? This exam covers everything ranging from clinical knowledge like respiratory, hematology, cardiology, and some academic branches like anatomy and pharmacology. There's also ethical sides to it. So there's an ethics section, there's epidemiology. It covers everything you need to know as a FY2 working in the UK. This exam is 180 questions it's an MCQ format and it takes 3 hours. So we've been prepared as Manchester graduates for MCQs our entire life. So this is where we excel. We know how to do MCQs. In a single MCQ in 1 minute is easy for us, but it is quite long because it's 180 questions. But hopefully you have the time management down, being grilled in uni for 6 years doing the MCQs. How long does it take to prepare for this exam? So this is also very variable and subjective. I would recommend 3 months to prepare for a PLAB 1 exam. Sometimes if you feel like, usually when someone learns something in a month or so, it takes me 2 months, then double that period by all means. If you're a fast learner, then cut that in half. It took me 6 weeks to prepare for this exam, which is not advisable to anyone because I booked a seat for somebody who canceled it. Also, yeah, to bring up that point, do not lose hope if all the seats for this year is filled up. Sometimes people cancel seats. So keep your eyes on the GMC website. A canceled seat might turn up and you can be the lucky person that gets that. That is what happened for me for PLAB 1. I got somebody who canceled a seat. So the time required, I would recommend 3 months. 3 months is it's enough time to allow you to do something on the side. Like let's say if you're working or you're doing your MTS or your internship, you need to have time to go in the morning and then study at night. So you're not studying your full 10 hours a day or so. If you're going to do more dedicated studying, it can be done in a month, but it's not advisable. Again, just check your pace. Look how fast it's taking you to complete sections of the question bank, and then you can decide how long it will take you. So the resources to study for PLAB 1, the most important resource is Plabable. This is an online question bank. It has about 2,500 questions. Plabable is the exam. This is what you need. Everything else. There are other resources available online. There are PLAB keys or PLABverse. There's so many others. But what's important and universal and everyone focuses on is Plabable. These questions are the most important thing that you need to focus on. You need to complete Plabable at least twice. It's weird that you might need to complete questions, do the same question again. Yes, you need to do it again. PLAB 1 is all about repetition. If you do not repeat the information twice or 3 times even, which is even better, you'll forget it. So you'll know, you recognize the question, but you can't answer it. You feel like, I don't really recall what the answer was. So Plabable has MCQs, and then after the MCQs, there's like an explanation section. You need to go through the explanation section. You cannot skip that. You have to read through all of it. And as I said, repetition is key. Twice at least. You can do it 3 times is even better. So you have to, even if, for me, luckily, when I was studying in med school, I always loved repetition. This was my method of studying. I would read the lecture once, do it again on the weekend. I have to do it like that. But some people don't do that. Some people just read it once and it's in their memory, it's stuck. But for PLAB 1, you have to do it twice, unfortunately. That's the overruling advice everyone has given who has sat this exam. Okay, so PLAB 2. What is PLAB 2? PLAB 2 is similar to our OSCEs, like our exit OSCE, except it's a bit longer than the exit one. So it's 16 stations, 16 OSCE stations. Each station is 8 minutes. You have 1.5 minutes at the beginning of the station to stand in front of the cubicle and read the question. Okay, so I'm being told that the slides are not moving. Are they moving now? Let me just escape and go back in. Yeah, are they moving now?
Yes, they are.
Okay, great. Okay, so PLAB 2, 16 stations. There are 2 rest stations, so in total 18 stations. It's a 3-hour exam. It is exhausting, but you'll get through it. The exit exam is a very nice mock for the PLAB 2, if you will. 8 minutes, 1.5 minutes in the front of the cubicle reading your STEM or your question before you go in and meet your patient. It's not an actual patient, it's a simulator sitting there with a scenario just like our OSCE role players. You have different types of stations. You have history taking stations, examinations where you examine mannequins. Because of COVID, it's mannequins. Maybe that will change by your exam. So definitely check the GMC website for any changes. You have teaching stations where you have to teach someone, like a nurse or a parent, how to use EpiPen, or you teach a nurse how to do an ECG or so on. You have procedural stations where you insert an IV line or you do an ABG or urinary catheterization and so on. You also have prescription stations where you prescribe some medications in the official method in the UK. There's a specific way you prescribe. There's also a sim man station, which is a simulation man. It's like a mannequin or a doll, but it's very lifelike. So you can feel the pulse. You can hear him breathing. He will respond to you. He will open his eyes. He would have findings on him. Like you go into the station and it's like a ALS station or a acutely unwell patient. You do your A to E assessment, A, B, C, D, E. We all know those. We do them on this mannequin who is responding to us, who actually has the findings, and the examiner is sat in the corner of the room, carefully judging you. So you have a variable amount of stations. There's no fixed like sections, like you don't always have equal amounts of procedures and history. It's always a mixed bag. Um, so when do you book your PLAB 2 exam? Luckily, the GMC has learned from its mistakes, and what they do now is they release PLAB 2 slots immediately after PLAB 1, you pass PLAB 1. So let's say for the people that sat PLAB 1 in August, they're going to get their results, I think, next week. When they get their results, same day, they can book PLAB 2. They're going to have some slots allocated by the GMC for them to book PLAB 2. PLAB 2 runs throughout the year, every day. So it's easier to get a seat on PLAB 2. The GMC makes sure that everyone who passes the exam has a seat. So you're not scrambling to get your seat like PLAB 1. So that is a plus. The PLAB 2 exam also happens only in Manchester. That is something you should know about. The fees. So the fees for PLAB 1 and PLAB 2 have recently increased, unfortunately. PLAB 1 is £247 and PLAB 2 is £906. So keeping the fees in mind is important, because when you want to book your exam, you want your credit card ready with the fees in there, and you want to be quick. Okay, so what does PLAB 2 cover? I did this bit. So it covers the 16 stations, like I said. How are you marked in these 16 stations? So the marking is in 3 separate domains. The data gathering domain, the management, and the interpersonal skills. Every station is going to be marked at 12 marks. 4 for data gathering, 4 for clinical management, and 4 for interpersonal skills. So your skills are important. How you approach the station is important. PLAB 2 is basically a communication exam. It's not about your medical knowledge. It's not about how much information you know, or you know a rare side effect to a medication, or you know exactly how to perform an appendectomy. All of that is not important. It's how you relay your information to your patients and how you communicate to them. Those 4 interpersonal skills are what make or break your station. And then data gathering, we all know how to do history. We've been doing them in the OSCEs our entire medical career at uni. And management, it's very easy to know exactly what to manage. You have to remember that you are being examined or tested as a FY2 doctor, not higher. You're not required to do complex procedures. It's just manage the patient in front of you. I'm going to give you medications. Okay, I'm going to send you to a specialist. I'm going to do so and so. Explain everything. Make sure your patient understands. Make sure you're a safe doctor. PLAB 2, if anything you're going to do in the station, you have to show the examiner you're safe. You're going to say, oh, I don't know your diagnosis currently. I'm going to speak to my senior who can do so and so investigations to make sure that you don't have anything serious and so on. So being safe is very important, and it pays off marks wise. So to pass PLAB 2, there is no fixed mark. It's variable. They do like a whole statistic, and they see how many people pass certain stations, and then they give you the exact mark. You have overall mark you have to pass, and you have to pass at least 10 stations out of the 16. So even if you get a high mark, higher than the total that they need, but you do not pass all 10 stations, it means you have to redo PLAB 2 again, unfortunately. It's very complex and very annoying in that sense, but that's something to keep in mind as well. Okay, so how much time is required to prepare for PLAB 2? Again, personally, I would recommend at least 4 months. You can add to that or do less. Certainly, there are people who do it in a month. There are people who do it in longer. So it really depends. The resources for PLAB 2, they're available everywhere. There are 500 or more stations. The scripts are well known. Those are the ones that come in the exam. You'll find them everywhere. The problem isn't with the scripts or the stations. You already know the station. It just depends on your performance. So that's the thing you need to work on. You need to practice. You need to practice with your colleagues. You need to practice with everyone you can. There's also academies available, which are courses where when you come to Manchester or you come to the UK, you can attend an academy for a month or so, where you get to practice with mannequins and the Simman doll, and you do the procedures. You get your hand used to the stuff, so you're not familiarizing yourself with the equipment on the day of the test. That is also recommended. Some people certainly do not take academies. Again, this is also depends. It's very subjective. So I would recommend full months. It took me 3 months to prepare, but I felt like I needed an extra month. So the key for PLAB 2 is practice. You have to practice. I was told this and I ignored this advice. Do not be like me. You have to practice. Start practicing from day one before even studying anything. Practice stations with your friends. One person is the doctor, one person is the patient. And you get used to asking questions. You get used to being in that position where you're going to be in the exam. Okay. So I'm sorry if this is taking very long. So the GMC registration. So to get to the GMC registration, after you pass PLAB 1 and you pass PLAB 2, the first thing you need to keep in mind is you need an EPIC verification. An EPIC verification is basically an external website where you need to get your primary medical qualification or your certificate, your graduation certificate verified. This takes time. So my recommendation is getting your EPIC verification immediately after PLAB 2 exam, not result. So after the PLAB 2 exam, you have about a month before your results come in. Get your EPIC verification ready and set before you start your GMC registration application. It took me about 10 days, which I was very lucky, but I heard people that it took them a month or even longer to get their verification by EPIC. So on your GMC registration application, you need to detail exactly what you did in the last 5 years with every single gap explained. So for me, I just finished my internship. So I detailed my internship here and what I did there. The month after, it was a month after my internship. So I said during that month, I was waiting for my GMC registration. Before my internship, I had 3 months. So because the internship in Egypt starts in March and we finished or graduated in December, technically on the certificate, there are 3 months that you need to sort of speak to. So we said those 3 months it took me to apply for the internship or it to finish the graduation paperwork. And then you go back. The year before, I was in year 6. The year before, I was in year 5. Explain everything. You have to explain the last 5 years. That's a very long application. It's very tedious, but you have to get through it. So what evidence do they need exactly? After the application, you're done, you've sent it off. There are also fees for this GMC registration application, so keep that in mind. I don't know off the top of my head how much it was, but you should look that up as well. You need scans of these. So you're going to send a PDF file with everything I have listed in this list. So you need the scan of your passport, the scan of your primary medical qualification or your certificate of graduation, or they call it شهادة الكرتون. The only thing is, شهادة الكرتون is in Arabic. You can get an English version of it from uni. Ask for the English version, that works. Some people get the Arabic شهادة الكرتون and translate it. That's up to you. But what I did, I got the English version and the GMC accepted it, and it was great and easier actually. So passport, prior medical qualification, certificate of good standing. You get this from the Naqaba. The Naqaba is the medical syndicate where you register after you finish your MTS, which makes you a licensed physician to practice in Egypt. Again, for me, I did not register in the Naqaba. I do not have a certificate of good standing, so I skipped this step. You can skip it. You just need to tell the GMC registration, I am not licensed to practice in Egypt, and they will understand. The GMC responds and reads emails and they give you advice accordingly. They don't have a set fix of rules. They change for everyone. So explain your situation and they are very much understanding. You have to be honest. You have to be 100% honest on your application. That is the key information you need to get out of this talk. Okay, after that, you upload your OET or IELTS certificate. You upload an evidence of completion of an acceptable pattern of experience, which is the internship. The GMC needs 12 continuous months of internship. Continuous. Do not be like me and have gaps in your internship. This is very, very, very important. Pay attention to your attendance in NTS. It's important. It matters if you care about a GMC registration. And translations, if you're going to translate any document of the above, you upload your translations. You need an employer reference. So the employer reference for someone like me who was freshly graduated was a Gen 1 form. The Gen 1 form you get signed from the شؤون الأطباء, which is the people that are responsible for the MTS. So that office, they know this paper. You go in with the form, they already know the drill. So you print it out. The file is available online. You fill out the information and you have it signed by شؤون الأطباء or الامتياز, the people about like that. So this is a photo that I found on the GMC website. It details what happens in your application. What you do is you apply online. Once they've received your application, within 5 days, they say 5 days, but sometimes it takes longer, so you have to be patient. They'll tell you if they need any further evidence. If they do, they'll email you and ask for the further evidence. If not, they'll tell you your application is complete and they will send you an invite for an ID check. Again, this is new. For me, my ID check was during PLAB 2, sorry. I apologize. So during PLAB 2, before the exam started, I did my ID check. I got my photograph taken. My passport was looked at. So the ID check I did in my PLAB 2 exam. Now, after COVID, they do it in person again. So they will ask you to come back to the UK and do an ID check within 6 months of their invitation email. So it's good to keep that in mind when you're planning out your journey to the UK during PLAB 2. Do you stay and wait for your results? And then after that, do your GMC registration application and then just wait and do the ID check? Or do you come back to Egypt and then go back again and do your ID check? It's something to keep in mind. It's something to think about, so you're not frantically looking for tickets last minute. Okay, so just a brief, very, very quick overview about job applications. This is a very big topic, but these are some hints that I want to give you in case you don't get them anywhere else. So where do you apply for jobs? As soon as you get your GMC registration, even before you can apply for jobs, but I waited to get my GMC registration done. The websites you apply for are Track or Health Jobs UK. They're the same thing. And NHS Jobs. These are the two main websites. I use Track. I like Track. I like the interface on Track. It's easier for me. So I wasn't really opening NHS Jobs as much, but you have the same adverts on both of them, but Track has more. So that's why I was focused more on Track. Which jobs do you apply to? So if you're someone like me who's freshly graduated, who has no experience to her name, you need to apply to specific jobs, only junior doctor roles. So the roles you're going to apply to on the NHS website or the Track website, there's a lot of abbreviations. They can be confusing, but the ones that you want to apply to are Junior Clinical Fellow or JCF, like the job I'm doing right now. F3, same thing. SHO, same thing. FY1 or FY2, same thing, but relatively the pay is different. F1 and F2 is the same thing. CT1 or CT2 or ST1, ST2, they're all junior grades. So those are the ones you want to be applying to. You don't want to be someone who just did an internship applying to a job like a senior clinical fellow or a registrar position that is above your grade. You do not apply to those. So this is something to keep in mind when you get confused by all the abbreviations. You need to prepare your supporting information well in advance. So what I did was I got my GMC registration. I sat there, I opened a Word document and I typed up 1,500 words or of supporting information. So I sectioned it in a Word, not in the Track website. I did it in a Word document, so I have the information there. Whenever I need it, I copy and paste into the Track application. So I typed up a personal statement detailing why I want to apply to certain jobs or why medicine is my passion and so on. So just a short one, 500 words or so. You detail your practical experiences, what you did in the internship, all the practical procedures you know how to do. List them all, and then any research or academic writing. If you haven't done any research or academic writing, do not worry. Manchester prepared us for this. You can use your poster presentations. You can speak about any or the essays you've written. Those are all research and academic writing, so they come in handy here. The presentations I've done, all the student presentations I've done, even from semester one, I've detailed them. And then any teaching you might have done, any bedside teaching you might have done, any teaching to your peers you might have done, any teaching I've done to my brother, because my brother is younger than me, I've detailed all that. So I don't have any formal teaching experience, but I have informal teaching experience, which is required, which is good enough. Also, any prizes of or academic distinctions you might have, and any additional skills you want to detail. Write that up, write everything up, make sure you do that well in advance before you start applying, so you have all the information available. I also recommend that you might take an ALS course or advanced life support course. I'd recommend doing that during your internship or your MTS. It is not a requirement in every single job to have an ALS, but it boosts your CV. So it's something easy, it's something you can do. Why not do it, is what I would say. So the ALS course done in Egypt by the European Resuscitation Council is acceptable in the UK. You can use that as evidence that you've completed it. The BLS that is done in Egypt by the European Resuscitation Council is not, unfortunately. So you have to do the UK Resuscitation Council of the BLS for it to be acceptable, if you want to keep that in mind. So also you can do a clinical attachment, which is something I did. So a clinical attachment is it's like a shadowing job, or it's like your elective. It's exactly like your elective. If you are in the final year, you know what an elective is. You do this after graduation. So you send emails to everyone, every consultant in every hospital, anyone who would respond. There are universities and hospitals that have formal programs that have clinical attachment programs. So I went to West Middlesex Hospital, that is part of the Chelsea Westminster Trust. They had a clinical attachment program that was 2 weeks, where I did it in general surgery, where I shadowed a consultant for certain specific hours of the day, and the rest of the day we had lectures. It was a very nice program. If you can apply to that, apply to that. Seats are limited, but you can find other programs like that in various areas all over England, not just London. So I would recommend trying to do a clinical attachment, or keep that in mind. So make sure you program or you schedule your attachment to be done after PLAB 2. So you're in the UK, you've done your academy, you're there for about a month, you've taken your PLAB 2 exam, stay for a while, stay for about a month doing your attachment, so you have something on your CV that the attachment counts towards NHS experience. So NHS experience sometimes is an essential criteria for a lot of jobs. So it's important that it's not like very, very, very essential, but I would say it is essential enough to do. Okay, so top tips. You want to complete the entire form. Do not leave any blank sections. It's a long form. Every job application is long. It takes hours. You don't want to fill out the whole thing. You have to. If you want someone to hire you, you have to show that you put in the effort, that you actually want them to hire you. So don't leave any blank section. You have to read the person's specification carefully. I'll show you what a person's specification is. So this is the person specifications. You'll find a person's specification for every job application. This is the one for the job I'm currently working at. You want to look at the essential and desirable criteria. So the essential criteria for this job is following the Royal Free World Class values. You don't just look at this and say that, oh, so I'm a welcoming person, I'm respectful, I'm communicating, that's fine. You need to tell them that you are. So you need to write this down in your supporting information. Make sure you mention everything. Yes, I'm welcoming because I do so and so. This is the time to sell yourself. You have to sell everything you have. Even if you don't believe it, you have to fake it till you'll make it. But don't lie. You have to be honest as well. So after that, it says it needs, all jobs are going to have an essential criteria like a full UK GMC registration. MRCP here is a desirable criteria. It's not essential. So if you have it, great. If you don't, It doesn't mean you can't apply to this job. You have to have a primary medical qualification recognized with the GMC, which is fine. Additional qualifications like bachelor's or master's, it's desirable. I didn't have that. It's fine. Evidence of appropriate general and acute medical experience is essential. So you go into your supporting information. You mention your general or acute medicine rotation in MTS and what you did and what type of patients you've seen, and just speak about that. So note everything in the essential criteria and type it down is my point that I'm trying to get across. Okay. Let me just skip through all this unnecessary. So read the person specification carefully and then use the supporting information section well. If it says on the application that a GMC registration is essential, do not assume that they know you're GMC registered. You write it down again. There is a bit in track where it asks you, are you GMC registered or not? You say yes, and you assume, anyone reading this application is going to see that. No, write it down again in the supporting information. If I'm giving you any advice, is the supporting information has to be great for your job. So reference all the elements of the person specification within your application. That's what I just said. And you have to be patient. So it's going to happen when it's going to happen. There is no set criteria for getting a job quicker than anyone else. Some people get it in a week. Some people get it in a year. So do not compare yourself to anyone else. Be patient. Work on your job applications. You're going to get there eventually. Okay. And thank you. That is it for me. Okay. So I finished exactly on time, maybe 5 minutes extra.
Thank you, Dr. Anesa, for this amazing talk. And actually, some people were having concerns or questions that they sent in the chat.
Great.
Now we're going to read them with Noor.
Okay, so thank you so much for being with us today, Dr. Anesa. You have been so informative and super helpful. I'm just gonna start reading the questions for you.
Okay.
Okay, so the first question is why did you choose PLAB over MRCS or MRCP?
Okay, so for me, I did not have an option of staying in Egypt and working there and getting experience because I was born in the UK. I do not have an Egyptian nationality, so I was always going to move back. So for me, it was the quickest way to get into the NHS and start working, and I didn't want to stay unemployed for very long. So PLAB was the only route for me. This, of course, differs for other people. Some people stay in Egypt and do they work there for 1 year or 2 years until they figure out what they want to do. So maybe then consider MRCS or MRCP. But for me, that wasn't an option.
Okay, so the second question, I think you covered it. It was will the graduates of 2024 have to take PLAB exams or UKLME? I think we covered this one.
Yeah, we did.
The second one was how is the pathway for the medical intern program between our university and the Lancaster Hospital?
Yeah, so I wanted to apply to that actually last year when the applications were opening. They had a Zoom session and I was actually I attended that, and the question was asked, can I apply if I have not sat PLAB 2 yet? And they said no, which was different from the year prior. They allowed that before, but since they said no, I did not apply because I was going to sit my exams in March and the application was starting in January, so I missed out on that opportunity. But if you're going to get your PLAB 2 exams before the application process starts this January, I would recommend going for it. It is a good program. It's 2 years. It's a bit long. So you stay 2 years in a non-training grade. You get a pay cut because you're paying for your diploma, which is a plus. Obviously, a diploma is a good thing, but you're not getting paid as much as everyone else who's working a non-training job. So that is something to keep in mind. But it's a quick way to get a job, is what I would say. So it was something I was looking forward to, but unfortunately I couldn't do. I was going to apply this year if I didn't get a job, but alhamdulillah, I got a job before that.
Okay, so moving on to the next question. Someone asked if there is any representative from our faculty for UKFP slash PLAB related affair that they can contact in the future, if you contacted anyone.
Honestly, I have no idea if there is anyone from our faculty. I would help anyone, so you can contact me definitely. Let me type in the chat my email address. I will definitely respond to anyone who sends me any questions. And if you know me personally, you've been speaking to me through WhatsApp or whatever, but my email address is down there. If anyone needs any questions, you can ask me, and whenever I'm free, I will answer them.
Okay, thank you so much, Dr. Anisa. The next one is not a question, but it's a note. It's from Abdullah. He tells you that he's so proud of you.
Thank you.
We are actually too, all of us.
Yeah.
Thank you very
Um,
much.
so the next one is what is EPIC verification?
So Epic is an external website. It's an American website. The GMC requires that your certificate needs to be verified from them. So you sign up, there's a whole application process. You fill in information like personal information and information about your primary medical qualification. Then you upload a scan of your certificate. They look at it and they send the email to the university. So it was Maktab Amin al-Kulliya, I think. That's the person I went to who I asked to respond to the email. They get an email from Epic saying, is Dr. So-and-so, has she studied in Egypt? Because you could forge your certificate. It's a way for them to make sure that everything is uh, legit, basically. So you do that and you go speak to them and they will respond to the email, and then you're Epic verified. You have the ID which you put into your GMC registration application, if that makes sense. So it's an extra step to be aware of, uh, to do before you get into the registration bit.
Okay, so the next question is does Mansoura Manchester offer opportunities to do elective in the UK?
Mansoura Manchester did offer. Up till COVID, they sent a group of people to do an exchange program in Manchester. I don't know if the program is back or not. It's worth asking. But even if you do not do the program, so when I was in my final year final year, I didn't apply to the exchange program. I actually applied to Imperial College London for an elective with them for 6 weeks, which was paid, obviously. But they accepted me, and I was going to do my 6 weeks in London. But then COVID happened, and nobody went anywhere, so that was cancelled. I think Imperial still hasn't opened up applications. It's worth looking out for if they have. So next year, check if Imperial College, also UCL, does it. There's a lot of universities that does it, but the ones that I was looking for were the ones in London because I live in London. I think St. George's does it as well. So it's definitely something to look out for because electives are very common in the UK and UK graduates do it as well. So just email the university. You're not going to lose anything by asking. So ask them if they do it and if you can apply as IMG.
Okay, so the next question, what are the general tasks of a junior doctor, and will there be training prior to starting the job?
So unfortunately, you won't get training everywhere. Some places are well supported when you're in a trust grade job, and some places are not. So for me, I was very wary and I was scared going into it because of my limited experience. I didn't want to have a lot of tasks to do, so I wanted to do some shadowing initially, which I didn't get the chance to. So I started working 3 days in. The first 3 days I wasn't working because I didn't have my electronic card that allows me to access patient notes. But then after I got them, I started working immediately. The tasks you're required to do, so you always have your registrar with you. You always have a consultant there. You can ask everyone questions. So my tip would be ask questions about everything, like a tiny abbreviation that does not seem that important. No, you need to know what that means because you're going to speak to someone over the phone about a patient and they're going to ask you something and you're not going to know the answer. So ask questions. You're going to be well supported. Nobody's going to be upset. that you're asking them questions. So what would a day-to-day of your job entail? You'll do ward rounds. So you'll be looking after, let's say, 10 patients today. You're going to do a ward round with a consultant or a reg. They're going to request certain things done for this patient. Get him an x-ray, take bloods, speak to respiratory about so-and-so. You have a list of things to do and you do them. Your reg is there in the room. You speak to him if you need anything. You speak to your fellow juniors. It's quite easy. So there's nothing to be scared of. And you won't be doing anything major, like any major procedures or so. So, but because I'm only doing cardiology, that's how it is for me so far.
Okay, so the next question is, did the Mansoura Manchester Medical Program give you any noticeable advantage over the other programs in terms of preparation and skills?
So I think for me, the only the advantages in PLAB 1 were I just finished my exit exam. I studied a lot of information of medicine, surgery, oncology, accident emergency. So all of that was very important and it helped me. It made preparation time shorter. Also being used to MCQs, I think the traditional program are not used to MCQs as much as we are, or maybe they have more time with the questions. So time management wise, I think it helped. Being used to MCQs, having studied all that helped. What else? In OSCEs, because we're used to OSCE settings. It's very similar to our OSCEs, but it's different in the sense where in our OSCEs, you go into the station, you ask the role player a couple of questions, and then your whole station is talking to your examiner or the doctor that is questioning you. But in PLAB 2, you do not acknowledge the examiner's existence. You don't even look at him. You don't say hi to him. He's just in the room. It's you and your patient. You explain everything to him. You explain what you're going to do, what you want to, the next steps. The patient is always involved in his management, opposed to in Egypt. So you're going to ask him, is it okay if we have an x-ray? Is it okay if you do this procedure? They say yes or no. So you have to involve them as much as you can. So it's similar and different at the same time. Maybe it gives you advantage, but not like any major advantage, I would say.
Okay, so the next question is, someone asked if you can send the important references.
Yes, I'll make a
I
list
think we
of
discussed
all the
this one, and she's
resources.
gonna, I think Dr. Anesa is gonna offer the references. Okay, so the next question is, should someone be graduated before they apply for the PLAB test? I think we covered this one.
Yes, yes, you definitely have to be. This is something also that I was thinking about, because what I wanted to do was I wanted to apply to F1 and F2 here in the UK instead of doing internship in Egypt. So that whole thing did not work out because of when we graduate is different to the people in the UK. And if I would have done that, it would have meant having 2 years, 2 gap years. So I finish uni, finish year 6, stay for 2 years doing nothing, being unemployed, and then start F1 and then F2. So it's that's 4 years before going to training. That's why I did not do that. So yeah, you have to have an end date, a graduation date, to apply for the GMC online account, as far as I know.
Okay, so there is a continuation for the question, but I didn't see it. When you applied for the exam and when you took the university certificate, if it helped in the applying process?
I did not have my certificate when I was applying for PLAB 1. So what I did, I finished uni. So we graduated in February, and I did my PLAB 1 exam in August. So I had enough time to have an end date. Our certificate, it's just I didn't go and get it, but it's easy to get. You don't need your certificate except for your GMC registration. So you don't need to get it immediately. You have to have an end date is the important thing.
Okay, so the next question is, how much does the elective cost in average?
So I don't know. It's very, very different
Very
according
hard,
to every trust and every hospital. The one I was applying to was Imperial College, and I think it was 6 weeks for £600, if I'm not mistaken. Maybe it was more, I'm not sure. And I think UCL was 8 weeks for 800. So on average, I would say a week is 100, 150. It's worth asking. And also some clinical attachments are paid as well. That's something they don't tell you. They are some clinical attachments would charge 1,000 or even more. So some of them are very, very wrong what they're doing. Some of them are free. So you should ask before applying or accepting something.
So the next question is, I think it's the same question that you asked before, but I'm just gonna say it. It's, I think it's what is the finish date or what is the date of the exam? What is the beginning of the exam? I think
Yeah.
it's the
So
same. Yeah.
the only thing is, finish date for me, my OSCE was in February, but on my certificate it said I finished on December 2020. So it's worth looking at the certificate because officially we should have finished by December because of COVID. We got prolonged into February. So the finish date would be on the certificate. That's something you can ask the people that make the certificate. To be sure. But also, I think what I did for my GMC online account is I actually wrote down February 2021, and then I changed it during my GMC registration process. So you can change this. It's not permanent, but your finish date would be on your certificate anyway.
Okay, so the next one, I think. Okay, I'm just gonna say this one. Someone says that they have heard that the certain surgical specialties are hard to get. So what's your opinion on something like this?
I wouldn't have any idea because I'm not in training and I'm
Yeah.
not planning to get into training next year. But nothing is impossible, is what I would say. For me, I want to get into surgery, and I know it's hard, and I know the training process is difficult. But if I set my mind to it, I'm gonna do it. So that's how you're supposed to think about things. If you want it, you're gonna get it.
Okay, and that's the end of our questions.
Thank you very much.
Thank you.
Thank you, everyone. Thank you for having me.
Thank you.
Thank you, Dr. Anesa, for being with us today. You've been so helpful for us.
Thank you very much. I will send you the resources, inshallah. And if anyone needs any questions, you can let me know.
Okay, thank you.
Thank you. Bye.